Okay, so the previous class we started looking at HIV and AIDS. We looked at the introductory part of HIV and AIDS. We looked at the abbreviation of HIV and AIDS. We said these two, they stand for something else. So what does the term HIV or the abbreviation HIV stand for? What does it stand for? And AIDS?
I've heard.
Syndrome. Okay, fine. So we also looked at the in-depth of HIV and AIDS, that HIV is a virus, AIDS is a disease. Then we also looked at the technicalities of what happens for the virus to migrate into becoming a disease called AIDS. Then we also looked at the factors that contribute for this virus to migrate from being a virus in the body, then becoming a disease called HIV and AIDS. So we looked at we talked of some of the factors that contribute to this virus to become a disease called HIV and called AIDS. So what are some of the factors that we looked at? Unfortunately, we only have one person who are together in the previous class. Factors that contribute for the progression of HIV becoming AIDS.
The stigma, weakened immune system, access to poor healthcare, poor nutrition.
So how does poor nutrition contribute to the progression of HIV into AIDS?
Poor nutrition. Okay. As we already said last week, that having HIV, there is
just say it the way it is.
Okay, this is who has HIV. Needs to be, okay, they need to remove.
You need help. How does poor quality nutrition contribute to the progression of HIV into AIDS? That's what we're looking for. Maybe you can help your friend.
Okay. It weakens the malnutrition weakens the immune body system.
Really?
Malnutrition, yeah. Because we have a so we are immune system out. So probably there's malnutrition, then maybe even immune body system. So AIDS, the body immune system
Is there no longer progress to AIDS?
HIV.
Okay, so when you're not having a proper diet, that means you don't have the necessary nutrients in your body. Thereby, that leads to the multiplication of the virus. In the rapid multiplication of the virus, that's the one which leads to HIV and which leads to AIDS. So if you're not having enough necessary nutrients in the body, that means your immune system is weak, which leads to the multiple multiplication of the virus, which thereafter leads to AIDS. How does a person's age contribute to the progression of HIV into AIDS? someone's age, how does it contribute to the progression of the HIV into AIDS?
As a person before, you need to be restricted from doing different types of activities, which may help to strengthen the body and the immune system, so that the body gets weaker and weaker, hence it gets room for the virus to be spread and it gets to age.
What about, we also looked at the presence of other infections in the body. We looked at the other presence of other infections in the body. How does it affect or how does it increase the chances of the progression of HIV into AIDS? The class, it's open to the whole class. We looked at this last class, but still more you can use your knowledge, general knowledge, to explain how does the presence of the presence of other infections in the body contribute to the progression of HIV into AIDS.
I'll give you an example of malaria. We say malaria. So malaria weakens your body and hence it creates room for the virus to spread easily. Since your body and your immune system is really so it creates room for the virus to spread.
Yeah, so apart from these factors that we looked at, person's age, body's ability to defend against HIV, the accessibility to quality health care, the presence of other infections, the person's genetic resistance to certain strains of HIV. The assignment mainly was for you to go and research and find out other factors that lead to the progression of HIV to AIDS. That was the assignment. So how many of us have done that? How many of us? We only looked at 4-5 points, and the rest was given to the class that we go and do further research so that we find out what are some of the contributing factors that lead the progression of HIV to AIDS, apart from the factors which we discussed here in class. So it's only one person who went and researched. What about the rest of us? For those of us who are not in class, we didn't even mind asking. Kuli, what did last week? No, you didn't ask your friend.
I mean, I was going.
Doesn't matter.
I wasn't in the group. I didn't know.
When have you joined the group? So you didn't know your classmates? You didn't know your classmates?
I've been asking them, but they were tricky.
Whom did you ask?
Asking. I asked
Who?
This week.
You asked them,
But they were ignoring me.
then you're not. How can your best classmates not ignore you?
I don't know. I think that's what I was far. They
So no, we're not. You mean we take this to the next? No, continue having the same excuses. Because we created the WhatsApp group for us to interact. At least one of us would have reminded our school guys assignment teacher bunch. Just a reminder. That's why the group is there. So that we interact. Anything, either assignment C or maybe coursework, we need to interact. Timekeeping, we need to interact in the group. That's why the group is there. Yeah. So the group has been quiet, not even one. Guys, assignment you went one. So everyone is getting a 0. Okay. So for those of us who have managed to write the assignment, can you please present to the class? This is not an excuse. You can still bring your computer and present to the class. You can present.
Morning class. So I'll take you through some other factors that can contribute the progression of HIV to AIDS. So I'll start with poverty. Poverty has also been underlined to contribute to the progression of HIV disease. This is evidence the study which highlights that in addition to having the highest prevalence of HIV in the world, Sub-Saharan countries are also among the poorest countries. Poverty was also underlined to limit the abilities of patients to access transport and healthy facilities, which further hampered the medical access to their adherence to ARV drugs. High poverty levels in most regions have also been attributed to lack of access to proper nutrition. So this simply means that with poverty, due to poverty, most of the people are unable to get drugs or even transportation money. So they lack transportation money to and from their places to the hospitals. So hence they can't be able to access ARVs. Hence HIV disease to spread and transmitted with AIDS. Gender. A number of studies have evidenced gender variations in levels of HIV, ARV levels, and rate of progression to AIDS. In particular, low levels of CD4 cells in women have been associated with higher levels of HIV-RN compared to men. Trypsomia CD4 count. Conversely, high CD4 T cells among women have been correlated with lower levels of HIV compared to men. Differences in the levels of viral foreign infection have been noted between men and women, with that of women being copies 15,103 copies ml and 50,766 copies for men. Racial variation. Previous studies on the influence of racial variation on the amount of CD4 cells counts and viral loads have produced inconsistency.
Excuse, is it the same point on gender?
No, I was done with gender. Now I'm on racial variation.
Racial variation.
Yeah,
Okay.
racial variation.
So that's the third point, eh?
Yeah, third
You've talked about poverty, you've talked about gender, then racial. Is it race or ratio?
Racial.
Racial variation.
Yeah.
Okay.
From race to racial.
Continue.
Okay. Previous studies on the influence of racial variation on the amount of CD4 cell counts and viral loads have produced inconsistent results due to inability to exclude confounders. However, results from Pantasis et al. Research that compared cohorts from South Africa and Europeans evidenced milder differences in CD4 count units. Cohorts from Africa were evidenced to have lower levels of CD4 cells at seroconversions, which was accompanied by lower rate of CD4 cell depletion. The slow decline in the rate of CD4 cells among Africans therefore did not confer any advantages to them. They were documented to reach similar levels of CD4 cell count to Europeans within 2.5 years, where their survival rates thus similar. I'm going to the fourth point. Injecting drug users. They have theoretical concerns of the effects of injecting drug use on the progression of HIV disease, where in vital studies suggest increased replication of HIV from drugs such as opioids. Nevertheless, clinical studies have often produced inconsistent results. The study from Mod et al. Identified that after initiation of HAART, the mortality rate of intravenous drugs users was similar to that of non-IGU. In retrospect, a study by the antiretroviral therapy cohort collaboration produced completely different results, where HIV positive expressed lower 51 life expectations compared to other groups. Drug use to low access to care and lack of adherence to medication, in particular interventions. Drug use at old age was linked to increased rate of HIV progression and mortality. Lastly, hemoglobin. The level of hemoglobin among HIV-infected populations has been evidenced to reflect to the rate of disease progression, whereby HB levels decline with increasing HIV disease progression. According to Quanti, this measure can be used as an independent prognosis marker irrespective of demographic differences. Decreasing levels of hemoglobin among HIV-positive individuals has been attributed to wide array of factors that include bleeding, suppression of bone marrow, and lack of sufficient diet. A positive correlation between the levels of hemoglobin and CD4 count decline has also been established among HIV-naive patients. Castro underlines that HB levels can act as an independent measurement of prognostic information similar to CD4 count, which makes it ideal for use in nations with limited resources. Thank you. This is what I had from the presentation. If you have any questions.
We can give you a clap, eh? Why? Clap for your friend. Yeah. After a presentation, definitely we're supposed to have some questions.
Yeah.
So we ask the one who's presenting. Yeah, you can go ahead.
Go ahead.
About gender, you were saying that according to your research, there are a lot of males who are positive or females.
I think let me just take you through. A number of studies have evidenced gender variations in levels of HIV, RNA levels, and rate of progression to AIDS. According to Langford Sterling, in particular, low levels of CD4 T cells in women have been associated with higher levels of HIV compared to men, with similar CD4 count.
So it's about the levels according to the gender, eh?
Yes.
Could this the other gender has like the other gender is more prone to the progression because of the way they make up because of their gender. If they are females, the others when they are males.
Yes. Any question?
Another question, please. Let's fire him with questions.
Or
Maybe you're afraid good answers up and fire my questions when you present your work.
I'll be prompted to ask you guys questions.
No questions? Okay, fine, then you can go sit down.
Can I ask them questions?
Yes, you can ask.
I talked about poverty as one of the factors. Can someone just take me through with a brief explanation on how poverty can help in the increasing our progression of HIV to AIDS? Someone?
I think you say some people they rent transport
Huh.
to go to the hospital and get the ARV.
Sure thing. Another thing? Talked about several things. Someone?
Okay, can go and sit down.
Thank you, madam.
So that was a very good presentation. Yeah, so our friend has looked, in fact, previously looked at almost 5 points. So our friend has added another 5 points. So it would have been very nice if all of us brought up different points, could have been comparing and contrasting. And you would have even noticed if someone who has brought in fake information, it's very easy. Because it would have happened, he has mentioned about poverty, then someone else again mentions about poverty, but explained in a different way. So when they did that, almost everyone presents their work, so that when everyone presents their work, at least we have much information on how this HIV can progress to AIDS. And it's even very easier for us to remember wherever we go, we're able to remember. Because just from the explanation which our friend has said, at least no one can forget that poverty helps in the progression of HIV and AIDS. And even our friend asked how does gender contribute to the progression of HIV into AIDS? In your work which has been well discussed in class, it's very easy for you to remember wherever you go, and it gives even an in-depth understanding. So the rest of us, when are we bringing in our work? Or maybe just Kira 0.
No. Yes, yes.
Okay, fine. So remember to hand in the way for the class. So today we want to look at the history of HIV and AIDS. That is perceptions on HIV and AIDS in Malawi. We want to look at the perception of HIV and AIDS in Malawi. So, from your own understanding, what is the perception that Malawians have in terms of this virus and the disease? What are the perceptions that are going around or go around in our communities?
When you have HIV and AIDS, you are done.
You are done.
Then it's the same that you die.
Okay.
Most of the people think that when you have HIV and AIDS, that's
Yes.
the end of life, so you can get
Exactly.
What are the other perceptions that people have in our communities concerning AIDS or HIV?
That being HIV positive is most of the people say that it's your fault. Like you have done something which was bad.
Okay.
You don't think that maybe you can do it from the virus.
At least almost each and everyone can mention 2 or 3. Because they're just perspectives, eh?
Yeah.
We are coming from different communities. It's not something that you can fail to give out a point. Yes? What are some of the perspectives in your community?
The perception,
Mm.
mostly in Malawi communities, they like when I go on and they conclude that you are HIV.
Okay? So being slim is associated with being HIV positive?
Just judge.
No, I'm saying, we're talking about the
Perception.
perceptions, eh?
Yeah.
Yeah, we're talking about perceptions. Yeah. Another one? What else?
You cannot get like whenever people decide no, that's say you're 9, you're really about also really because you have HIV and so you don't have a chance to get married.
To date.
Yeah.
Men have a higher percentage of HIV.
Men have high percentage of HIV. That's the perception. At the very back.
Short life expectancy. Short life expectancy.
Short life expectancy. It has already been said that one was the first point. Eh?
Okay. A lot of people believe that it's usually obtained through sex and products.
So that's the perception that people have in the community. Okay, so we're going to look at the history of HIV and AIDS. So according to the population, according to the studies, shows that between 1999 and 2005, the prevalence of HIV was in adults among 15 to 49 years of age. As like between these years, 1999 to 2002, the prevalence of this disease was mostly amongst people of the ages between 15 to 49. And by 2012, approximately 1,100,000 people in Malawi were HIV positive by 2012, which represented a 10.8% of the whole population of people who were positive by that time. Because the Malawian government was initially slow to respond to the pandemic under the leadership of Hastings Kamuzubanda, that's between 1966 to 1994. So the prevalence of HIV increased drastically between 1985, when the disease was first identified or it was identified in Malawi. So it's like the HIV and AIDS was first identified in Malawi in 1985. Now, because the government back then slowly responded to the disease, it led to the increase in like more people getting this disease. And by 1993, when HIV prevalence rates were estimated to be as high as 30%. So that means between 1999 to 2002, almost the disease was mostly between the ages of 19 to 49 people. To 49. That means all people ranging from the ages of 15 to 49 years of age were the ones who were mostly affected by this disease. Now, back then they represented a 10.8% of the whole population. That's approximately 1,100,000 people were affected by this disease out of the total population. Kumana, we see as the years progressed, the disease continued to increase to the extent it would be as high as 30% among pregnant women. The Malawian food crisis in 2002 resulted, which even made the situation to be worse. As you already remember, we talked about the nutrition, how nutrition helps in the progression of HIV and AIDS. So when the disease came here to Malawi, was discovered in 1985, there was slow response to the disease, which led to the increase of the disease among the people of the country. Then we saw drought, the country being hit by drought, which also had a very impact on the progression of the disease to be spread among the locals in the country. So various degrees of government involvement under the leadership of Bakili Mbuzi. That means from 1994 to 2004, there were a lot of initiatives which government put in place, and also Bingo in between 2004 to 2012 resulted in a gradual decline in the HIV prevalence. So the more government responded to the disease, the more we saw some changes. We have been seeing change. Back then during the Kamuzu era, there was no much response to the disease in among this disease. Like they were treating it like as any other disease, so it led to the increase. While when the other government came in, they went on publicizing to the public how dangerous the disease is, how you can get the disease, and even the condoms became widely available to the public through non-government organizations, and more Malawians till to date are taking the HIV testing services and even the antiretroviral drugs. So the first case of HIV in Malawi was reported in Lilongwe at Kamu Central Hospital in 1985. By then, President Banda was in power, and there were very little response to the disease. And back then, this disease was not talked here and there because it was considered to be a taboo. Anything concerning your sex life was not considered to be talked in public. It was supposed to be talked in private. So this led to the transmission, to this widely spread of the disease. It was illegal for Malawian citizens to discuss the epidemic openly. In 1989, Banda introduced a 5-year World Bank medium-term plan to combat the epidemic, but HIV prevalence had already increased drastically at this point. So it was in 1989. Remember, the disease occurred in Malawi in 1985. It took us up to 1989 when the president now had to come in with the funding from World Bank to combat this disease by. However, by then the disease had already widely spread. That means we responded slowly to the disease, which led to the widespread of the disease. But now when Bakili Mruzi came in, he was able to initiate that this disease be talked in public. While back then it was a taboo, it was not supposed to be talked in public. But with the coming in of Bakili Mruzi, he addressed the nation, the need for coordination, response to HIV and AIDS pandemic. In 2000, Mruzi introduced another 5-year policy known as the National Strategic Framework. But like Banda's 5-year World Bank Millennium Term, this plan was largely ineffective. So it's like really Banda and after seeing the disease now is getting widely, it's being spread, he brought in an initiative through the World Bank. But still more, that initiative didn't go as it was supposed to go. It was not able to eradicate the disease as it's supposed to be. And despite Bakili Mruzi came in, the policies are still more, there was very minimal change that was taking place in terms of people being aware of the disease. So in 2021, in response to the problem within the National AIDS Control Program, which was established by Banda, Mruzi also established commission here, it was known the National AIDS Commission. So the National AIDS Commission came after the other initiative which was put in place, the National AIDS Control Program by Banda. So the National AIDS Control Program migrated to the National AIDS Commission during the Mruzi era. So it was in 2003 when now the country Malawi had access to ARVs. So that means that during this time it was the ARVs came in with a donation from Global Fund to fight AIDS, tuberculosis, malaria, and other election of new and malaria. So this the ARVs came in 2003 with the donation from the Global Fund to fight against this disease and tuberculosis and malaria. Now when Bingu came into power, the government intervention increased. When Bingu came into power, the interventions of HIV increased. Soon after, Mutarika detention, implementing the anti-corruption program, which distracted the government from addressing the nation's food HIV. We see during the Bingu era, that's when Anna Misa the Janija program in AIP, which also led to the country having a lot of food. Because back then there was a famine which occurred in 2002. That famine also had a very big impact on the progression of the spread of HIV to AIDS in the country. But now when the country had a lot of food during the Bingu era, at least it helped to combat the spread of HIV and AIDS. The country having plenty of food, that's nutrition. That means at least the nutrition once the country was stable. Then you see the ARV coming in, so at least we had ARVs, we had enough food, so it helped to decrease the figures, even to let the people get aware of what HIV is, how it can be spread. People are being able to go to different health facilities and get tested to know their health status. So that's the history of HIV and AIDS in our country, Malawi. Now, despite Malawi limited health and education infrastructure knowledge regarding HIV and AIDS, according to a 2004 study by Baden, it shows it involves 100 healthcare. There was a study which was conducted which involved 100 households in Malawi to find out how people to find out how relevant or how aware people were in terms of this disease of HIV and AIDS. So this awareness was carried in radios, in television, health workers and local clinics and female members and social networks. in terms of HIV awareness, there's a saying that it is the females who are more aware of HIV than males. Is it true in terms of awareness of this disease? Is it true that it is females who are much more into this awareness than males? Or maybe it's not true in terms of awareness. Who are much more knowledgeable of this disease in terms of gender, male or female?
Females.
Why is it so?
This is try to increase men.
Mm-hmm.
In most cases, try to integrate the advice that are given by the government and other organizations. For example, if the organization try to organize a marriage, as men, women,
If NGOs try to organize HIV awareness campaigns, and what happens?
people who like to go there with women and men. Because men without it, they say we are going to complete this next month. So, as they try to integrate means one or the other, they miss some information.
Because women do experience a lot of things like natural. Like when you look at when a woman is pregnant, it's very advisable that she should go to the hospital and get tested for HIV. And then there they get counseling about HIV and it's whereby they have a lot of woman. And it's very important not to go with his wife to the hospital for something.
Why do men don't accompany their wives to the hospital when the lady is pregnant? Why? Why being shy? Why being shy?
I think that there is for women only.
But it's advised that when the lady is pregnant, you escort your wife to the hospital because a lot of this counseling happens there. So if you don't go there, that means definitely you don't have much awareness of how exactly your health status is. And some of the men can even shun up from getting tested. Okay, yeah, so it started.
I think men are risk takers.
Risk takers? In what context? In what context are they risk takers?
But I would like to ask someone who knows it.
You're the one who have brought up the okay, we're talking about why is it that men are less aware of HIV than females. Eh? So you're saying men are risk takers.
Yes.
So how is how is the relationship of men being risk takers with HIV awareness? So it's like
Madam, this that you can see that the code is. That's exactly.
So all the men in this class have got it.
No, not like that.
They are risk takers.
Men are risk takers.
How is it relevant to being aware of your HIV or being aware of HIV or HIV and AIDS?
Madam, assumption would be.
No, I don't know.
Maybe if you can just tell us in a nutshell, men are risk takers, so they don't mind being aware of HIV and AIDS. That's your point.
Nobody has they have that feeling like something can happen to them. If something will happen, they are going to do it like this. So, because everything, I'm not one of the solution for everything.
Oh, so men think there's a solution for everything.
Yes.
And they think it's so easy to
Get HIV.
yes, especially when especially when you're circumcised. I'm just madam.
Serious?
It's just an example.
So okay, so men think when they are circumcised, they don't need HIV information. They are at least safe. They don't need the awareness.
Yes. That's what the example.
Serious? How? So how is the circumcision and HIV awareness related? How are they related?
Although when you are circumcised, what's the percentage?
65%.
Says who? Says who? Where did you get the percentage? Says who?
Men want me I'm a color, okay. I'm a color selective for information. The information in if they don't know which are the
information is relevant to you.
Yeah, it's not fair as in so you know, can they don't cover 65%. Some of us are doing some of that. There is 65%.
So where did you get this 65% from?
I never
Which hospital did you go there?
They are the ones
they were promoting.
I mean, only once you get circumcised, you at least you are safe.
Yeah, not when you can get it, and then I can save it.
What now? Okay, no, wait first. From the explanation, Woody, when you get circumcised, you're safe, eh? Where does this safe come from? How is it related? Being circumcised and being safe. I want to understand from
They
that
have
point of
information there.
view.
They say that when you are circumcised, you are at least safe. Who do they get HIV? And when you are not, just because many they do have that foreskin.
The ones which they get rid of when they're getting
So
circumcised.
if you're having sex, that thing is very easy to
get cut.
Yes.
What?
So by that you can get HIV less than being circumcised.
You know what they think, okay.
Oh, so when you have the foreskin, so when you're having sex, it's very easy for you to get cuts.
Yes.
That's the point.
Like most people, someone who is circumcised,
Okay.
I want to understand.
The penis is only in the foreskin. So it's very easy. You might get cuts of body. What's about Kabuli?
You don't get cuts.
It becomes breathing. My chances are slow.
Okay, could they make the act of having sex?
Okay, during the
Act of having sex.
yeah. With the
With
friction, since you when you're having sex,
That's what those guys were saying, or maybe just that's what the circumcised the guys who were carrying out the campaign were saying.
Since when you're having sex, that friction now. No, when you're not circumcised with the foreskin, it's easy for the foreskin. Could he? It's in the materialist.
Foreskin just it's true foreskin.
When it's not properly cleaned, eh?
Yeah.
Oh yeah.
When you don't clean it, when you clean it properly. Also, that means for you when you don't clean, you don't have time to clean your private part. When you're there with your hand, you don't clean.
No, not like that. But then now I did that.
Yes,
They don't clean it.
Oh,
they don't clean.
not the men in this class.
Yes, not the men in this class, yes.
Okay, but then the willingness and advice of how
They've not been cancelled after growing up,
exactly. But then
so they don't clean it no bueno.
yes. And then
My infections.
and there's also that to when you're having sex. How it's simply my and then you get those guys.
Okay, so in an agreement, put it's very rare for men to have to get proper information about HIV and AIDS.
Yeah, using the information commission.
We are selective.
Yes.
Oh, you're very selective when it comes to
Information.
information.
Yes.
Okay, fine. So, according to this study, they said they found out when 57 Malawian men were interviewed in 2003, 100% of them said they had heard about HIV and AIDS pandemic on the radio, and 84 of them said they had learned about HIV/AIDS during their visits to local health facilities. This supports the fact that many people in Malawi have access to information about the pandemic, but through the study found out that most people have information about HIV pandemic both through radio and other resources like going to the hospital. So just a study which was conducted trying to find out how aware are people in terms of HIV and AIDS. Yeah, so they found out people have access to the information, either it's on the radio or maybe to health facilities or maybe they're having campaigns. So at least up to now people are aware, or maybe the degree of awareness varies. The degree of awareness varies.